This is Kevin Jefferson, the DC foot doctor. This patient came to me 3 months ago with severe wounds of his toes. Having diabetes and poor circulation, he was at high risk for amputation. However, with vascular intervention, great wound care, and family support, he was able to avoid that tragedy. His wounds have healed and he is now receiving regular diabetic foot care. Like this video and share it with your family and friends. Subscribe to the channel and ring the bell for notifications. Thank you for watching and take care of your feet. Welcome back, man. Things look great.
Say that again, Doc?
I said, welcome back. Things look great.
Okay.
Everything's all healed up.
Yeah.
It was touch and go, man, with these toes. I mean, all 5 of them. Came close to losing them, but when I had the good wound care going, you had the revascularization procedure performed on your left side. You said they still need to go back and do the right side?
Yeah.
Okay. All right, let's get everything else taken care of here. How's the foot feeling?
Yeah, okay.
Feels okay? Good.
Yeah.
And you're getting around okay? Nothing's nothing's bothering you or anything?
A couple weeks ago, it's like a tingling coming up, but I just don't pay it much mind and go away.
Okay. How long does it last when it comes on?
About 15 minutes. I was lying down,
Mm-hmm.
So I said maybe it's the blood circulation going down there.
All right.
But nothing's to be alarmed about. It go away.
Okay. Does it only happen when you're lying down?
Yeah.
Okay. Is that every time you're lying down or just sometimes?
Just 1 or 2 times, doctor.
Okay. Well, we'll keep an eye on that. If it begins to happen more frequently, you have to let me know.
Yes.
Okay. But to make sure there's nothing going on with the nerves in your feet.
Yeah.
That's what we call neuropathy.
Okay.
And we see that quite often in diabetes.
Yeah.
Okay. But everything else is going okay? Your blood sugar is staying good?
Yeah, blood sugar come out okay in the morning time. And this morning it was 6 to 9.
Mm-hmm.
And the day before it was 7 to 9.
Okay.
So I keep taking my insulin as directed by the doctor.
Okay.
And I'm kind of watching what I eat now.
Good. Yeah, you gotta.
My wife, she giving me a lot of vegetables.
Mm-hmm. Very good.
And I'm trying to drink a lot of water.
Good.
Because of my kidney,
Mm-hmm.
Kidney not functioning right, it's going down.
So what are they doing about that? Just watching it right now, or?
The doctor is giving me medication and they're mentioning to me about dialysis.
Dialysis already? They're talking about that already?
Yeah, but doctor, what are you going to do at my age and thing?
Mm-hmm.
And how many as a diabetic all these years,
Right.
Diabetic, as you know, doctor, it's a dangerous thing to have to be a diabetic.
Yes, sir.
They work on all parts of your body. Well, the most I do, most time, just pray to the Lord, ask Him to,
Mm-hmm.
keep me a little fit until the time comes.
Mm. Here we go.
When I was much younger,
Mm-hmm.
I kind of ignore what they were talking about as a diabetic, I just eat everything, do everything wrong.
Mm.
I think it gives me a problem now because I get older.
Mm-hmm. At what point did you grasp the reality of what was happening?
Hmm?
About what age were you really when you grasped what was really happening?
I was like 50.
Okay.
50, 55, yeah. Now I'm way up 82.
Hmm. Well, it's never too late to get started doing the right thing.
It's the wrong age, yeah. Oh boy.
Yes, sir.
Well, I think I did well. Traveled from 55 and then I'm 82 now.
Mm-hmm.
I think I did well.
Yes, sir. And you got your wife and daughter looking after you?
But I know a lot of people younger than me have it and they die.
Mm.
With a stroke or something.
Yeah.
I think it's playing a little tune in my heart now.
Mm.
The doctor says there's a number of blockage going to my heart.
And what are they gonna do about that?
So I'm supposed to see a heart doctor.
Okay. Do you have that visit already set up?
Yes, we're setting up an appointment to see the heart doctor.
Okay.
Because when I go up the stairs, I get short of breath and then went through some tests and they discovered that's what was going on. Is going on.
Okay. Let's see what's going on this side here. So how long has this issue with the shortness of breath been going on?
I really don't know how it's going to last. You mean for your heart?
Mm-hmm.
I don't know. We'll have to go back here Monday.
Okay. And when does the vascular doctor want to go back and do this right leg?
And this one I'll have to reschedule.
Okay.
My wife prefer for me to deal with the heart first before you go up to the leg.
Of course. The thing about heart, a lot of the symptoms that are associated with heart disease typically don't show themselves until there's a real problem. You know, it's like when people have their first heart attack or have a heart attack at all, there's nothing leading up to it. You know, there's nothing to tip them off that there may be a problem until it happens.
Yeah.
And the same thing with, you know, the blood vessels in the feet and legs. Sometimes we don't know there's a problem until there's a problem.
Yeah.
Which is why what we do here is that we test our diabetic patients and other patients who are at risk for vascular disease. We test their circulation on their feet at least once a year. That way we can catch things early and take appropriate action early before we get to the point where, you know, folks are losing toes and part of the foot and the leg. Like we were fortunate in your case that the vascular status in your left leg, where you had all the wounds on your toes, was able to be taken care of so that the toes could completely heal. I got a little bit of dry skin and callus formation back here in the heels. Shaving this down here for you. Okay. All right. Are you having any itching because of all the dry skin? You having any itching because of all the dry skin?
I don't get it like that.
Any itching back here in your feet?
No,
No?
no.
Okay. Look. That must have dry peeling skin. I'm going to prescribe a lotion for you for this dry skin, okay?
Yes.
There you go. The spots where it's rubbing against your shoe.
I give away shoes, doctor.
We're going to order you some shoes for diabetics today too.
Yeah.
Now that everything's all healed up, we can do that. No, I mean, the last time you were wearing a 10, even though I measured you at an 11. So that's part of what contributed to the issues you were having with your toes, wearing your shoes that were too small. That's what that was. All right. Very good, my man.
Great, doctor. I appreciate that.
You're very welcome.
Oh boy.
So we'll be seeing you soon.
First thing I've just done.
Yes, sir.
Yeah.
This is Kevin Jefferson, the DC Foot Doctor. Thank you for watching this video. Like it with a big thumbs up. To see very interesting cases and my approach and techniques to dealing with them, and to learn how you can improve your foot health, subscribe to the channel. Ring the bell so you will know when a new video has been uploaded. Follow me on social media at DC Foot Doctor. And most importantly, take care of your feet.